Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, everybody, and welcome to another edition of Doc Talk with Monument Health. Today, I'm being joined by Dr. Loren Jones and CNP Jeanette Carlson from Monument in Spearfish. Dr. Jones is an ENT, and Jeanette Carlson is a CNP in Sturgis. And when I first saw the subject we were talking about today, I got probably more excited than I should have, because when it's something that I personally experience, I'm like, oh boy, I've got questions. I got some things I can ask about. So let's just get started first, Dr. Jones. Your background. You said you were born and raised in Spearfish.
Yeah, born and raised in Spearfish. Graduated there in 91, I was in the Air Force for quite some time.
Oh, excellent.
Doing this job for the Air Force. And then when my commitment was up, we got a job back home.
So what kind of led you into this field? Why did you pick it?
Well, my third year medical school rotation in ENT was sort of by accident, because I didn't get my preferences in soon enough. And I just liked the people, liked the patients, liked the diseases that we treated.
Okay. Jeanette, what about you? How did you, you're from Sturgis, I believe, correct?
Yep, graduated from Sturgis. I've lived in the area my whole life. Currently live in Spearfish with my family now. I was a hospital nurse for 9 years, became a nurse practitioner, worked in urgent care for about 3 years, and I've been working with Dr. Jones for the past 3 years since then.
What is the difference in, the nursing designations? So like a nurse practitioner. Yeah.
So as a nurse practitioner, I basically get to do physical assessments and prescribe. And
I see. Okay.
We all take care of patients,
right.
But it's just in a different capacity, a
Excellent.
little bit higher level. So.
Okay, perfect. We're going to be talking over a series of topics here with both of you. And I think we can just kind of, jump right into questions that people have when they come in to see you, dealing with the term that I've seen all over the place. You see it in commercials, you see it listed on boxes of medication, but I wasn't sure what it meant, and it's postnasal drip. Is something that you see, obviously, quite a lot, right?
We do. We see quite a lot of patients who have that problem and that complaint. And really, it's just a sensation that you have something draining into your throat from your nose, as opposed to runny nose, or we'd say maybe anterior rhinorrhea, if we're being formal in the chart, coming out the front. So it's just nasal stuff that goes down the back. The interesting thing is your nose and sinuses make a lot of mucus every day, between a pint and a quart.
Well, what's the reason? Why do they do that? Why are they making that much?
Yeah, so all of your mucous membranes really require mucus to function. If it's absent, you are in a world of hurt. So,
really?
Dust that would settle is carried off by mucus with the little cilia on the cells beating the mucus back down, and then it goes down and helps lubricate the swallow and the whole throat. So, if, for example, a cancer patient who's had radiation to their throat and they're absent mucus and saliva, it's a real handicap. So you need it, but sometimes there's an abnormal amount, or there's something abnormal about it, and it feels uncomfortable.
So that's why when you get a runny nose, it can be it's an annoying thing that happens most of the time, right? Yeah. Mm-hmm. Do postnasal drips, runny nose, can they be indicative of things that are more serious, or are they generally just telling you something's just not quite right, and fix it?
Yeah, usually the symptoms like that, postnasal drip and runny nose, are typical of disease processes that are not life-threatening but are pretty annoying.
Right.
So it would be pretty rare for something like that to indicate a serious health threat that you really need to seek medical attention for, because you're going to have a bad outcome if you don't.
Okay, so is there reasons, if you're experiencing that you should ever visit a physician, if it's just that?
Yeah, for sure. Mainly just quality of life reasons. So if it's really just bothering you, affecting your quality of life, your ability to do the things you want to do without being interrupted, to constantly clear your throat or have your voice be rough, and in your line of business,
sure.
That would be something. If you had a lot of stuff that was sticking down by your vocal cords and causing your voice to not work the way you want it to, or having to blow your nose all the time, these sorts of things, can interrupt people in their private and professional lives, and people don't like to have to deal with that. So that's most of what we run into. It'd be pretty rare to see something bad that was truly a threat to somebody's health going on there.
So you can get obviously types of obstruction in your nose, right? Because we were talking before we started this, the polyps. It just seems like you can get those anywhere, and I'm surprised by that. Is that common for a lot of people, an obstruction like that?
Yeah, nasal polyps are probably overall a pretty uncommon cause of nasal obstruction. In our practice in ENT, we see it, not uncommonly. We see it fairly often, and they're a trouble. They're really just a result in the nose, not speaking of other areas of the body where they may occur, but in the nose, they're just a result of chronic and significant inflammation. And as the mucous membranes get inflamed, they swell, and then eventually they swell to the point where they kind of outpouch into an actual polyp type of tissue.
So can those like other polyps, can they turn cancerous? I mean, is that something
straightforward nasal polyps like we see with maybe bad allergies or chronic sinus infections in certain people are not something that ever turns to cancer.
Okay.
There are certain, obviously, kinds of growths in the nose and sinuses that can be cancers, but that's pretty uncommon.
So what are some treatments then? People, is over the counter basically enough for something like this? If you have runny nose or postnasal drip?
Yeah, I think it's a good place to start.
Okay.
So most people, that are experiencing runny nose and postnasal drip, and maybe they have some sneezing with it, and maybe itchy watery eyes, and maybe it's seasonal or maybe it's not, but a lot of people will quickly jump to the idea this is maybe allergy related, and they'll take some over-the-counter allergy medicines, some antihistamine pills, or the nasal steroid sprays are over-the-counter now, as well as our nasal antihistamine sprays. They're just one, but it's over-the-counter as well. And so people will often self-medicate at home for these sorts of symptoms, and that's just fine. And if you're doing that and, whatever, maybe it's spring through fall, you sneeze and have a runny nose and itchy watery eyes, and you take some Flonase or you take some Claritin or, whatever product you choose, and it helps, that's fine. You don't need to see a doctor, I think, at that point.
Now, what's the difference? Because I'm one of the guys, and I know it's probably not smart, but it almost seems every single night I can't breathe as well as I'd like to. So I turn to the Afrin, those kind of nasal sprays to clear that up. Is that smart? Is it dangerous?
Let's be gentle. No, it's not dangerous.
Right.
It can be counterproductive in the long run.
Okay.
So for short-term use, what I tell people about Afrin, and we give it to people, post-op sometimes and stuff for certain reasons, but generally I tell people if you're sick, like you have a cold, and you're really miserable, for a few days using Afrin is great. It's an amazingly effective medicine.
It is such a great drug.
It really will open up your nasal passageways. It works by constricting blood vessels in the nose, and that shrinks the tissues down. The tissues in the nose, some of them are almost like erectile tissue. They have a lot of vascular channels in them, and the Afrin shrinks those down, and the tissues shrink, and you can breathe. But that is something that really should only be used for 3, maybe 4 days at a time. Or you may end up with, our medical term is rhinitis medicamentosa, but this means that your nose has gotten to the point where it doesn't respond as well to the Afrin anymore, and then you get really bad rebound congestion. It's very hard to stop it. Okay. And some people's nose honestly tolerate that okay, but most people don't. So there's a small percentage of people that maybe could kind of live on that and do all right. But we see a fair number of people that come in and, I'm on Afrin all the time, and their nose looks like a red, inflamed, swollen wreck inside, and it's not working for them anymore. So we say 3 to 5 days. Yeah.
Okay. So, what's the difference then between that and you mentioned the nasal steroids that you can take, like Flonase and stuff?
Yeah.
You don't. I know I've used that in the past. You'll squirt it up your nose, and you don't feel that,
right?
That Afrin relief. So what is that doing over the long run?
Yeah, and the long run is key. So nasal steroids, whether it's Flonase, Nasacort, Nasonex, any of them, they're all functionally very similar. They are steroids, so they are broad spectrum anti-inflammatories, and so they treat underlying inflammation and decrease those inflammatory signals that are causing tissues to swell, and that's how you get some relief with them. But they don't work immediately. Usually we tell people to give them a good trial of 2 weeks before they say this isn't working for me. And people will feel maybe even they do get a little bit of a feeling, just a little fluid goes in there, and they feel, that helped a little bit, and then half an hour later they feel like it's gone, it's not doing anything, they don't give it a good enough try. But frankly, nasal steroids are the most effective broad spectrum medications for allergy symptoms in general, and most people attribute a lot of their nasal symptoms to allergy problems. They cover the most types of symptoms compared to antihistamines, which don't control stuffy nose, but the nasal steroids do help with that. So they're just the sort of thing that you do have to try for a bit of time.
So even better than you get your other types of medication that's just specifically for nasal, a pill form.
Mm-hmm.
So the actual spray would be better.
Yeah, they are more effective for a broader range of symptoms that are due to allergy. And the antihistamines are good for rapid relief. But the nasal steroids, if you know that March through September, March through October, whatever, you have trouble every year, then you'd want to start Nasacort or Flonase or something a couple weeks before that. Stick on it the whole time. Use your antihistamine pill as a backup potentially. Or you can even add an antihistamine nose spray. The Astelin is the
Oh, I didn't even know there was such a thing. I didn't know that existed, an antihistamine nose spray.
Yeah, it's been around for quite a number of years, maybe 20 years, but it's been over the counter for the last year or two.
Okay.
And what's the over-the-counter name? Is it Astapro? Is that the over-the-counter name that's available?
All right.
So, yeah, there's a lot of good options in over-the-counter medicine, but the key with the nasal steroids is to give them some time to work.
So is it recommended to stop using it over a certain time, though, with the steroids, too, and maybe just come back to it every season? Or can you really use it? If you need to use it year-round, you can use it year-round?
You can use it year-round forever. They're extremely safe medications. The steroids that they use for that have almost no systemic absorption when they're applied to the nose, and so there's almost zero risk of like taking steroid pills. You don't want to do that long term because it can have a lot of other adverse side effects. But with the nasal steroid sprays, it's not an issue. You can be on them for good.
Okay. Going back a little bit to that nasal obstruction, and I don't. This is just popping into my mind because I like to think of the weirdest things you've probably come across as far as obstructions go. Has there been something that you've just had to laugh when someone's come in and you're like, oh, good Lord, how did that get there?
There've been a couple. The two that really come to mind, I was working at an Army hospital in San Antonio, and there was a young woman who had come to the U.S. from Central America recently and was complaining of bright green nasal discharge and nasal blockage. And I looked in her nose, and there was this thing coated in bright green pus inside her nose, and I pulled it out, and it was a rock. And she said she had been in a landslide a couple of years before that. And so that had been in there a couple of years.
How can people live? Wouldn't you feel that? Wouldn't you know that that's in there? Or is it possible not to?
I think it's possible not to, and she probably knew that something felt blocked and that she was having the drainage, but she probably didn't have access to, an ENT physician in her home country easily, at least. And, it stayed
and
there.
And the Afrin was not going to help with that.
No, you gotta get some physical retrieval for that.
Oh, that's it. You said you had a second one too that came to mind, sort of?
Oh yeah, this was a similar deal. Who knows how long it had been there, but this person it looked to be a seashell. And this person was staying at a home for people with, mental disabilities. And, it was big seashell in this poor person's nose that had been there for who knows how long. So strange things do happen.
Yeah, I suppose. And you take care of it, and you kind of shake your head and say, please, in the future, let's not do that.
Yeah, please not.
Right. Well, it's been fun talking to you, Dr. Jones, about this. Ear, nose, and throat from Spearfish, talking about postnasal drip and runny noses. And really, they're not super serious. If you feel the need to see a doctor, though, you're not going to say, don't come see me if you have a runny nose, for sure.
We treat lots of it. If people are having symptoms that are not responding to over-the-counter medicines, they may have the wrong diagnosis. It may not be allergies. It may be something else. Or there's several other things we commonly see that cause a sense of postnasal drip, whether it's a different kind of rhinitis called vasomotor rhinitis or non-allergic rhinitis, or acid reflux, frankly, can cause a lot of postnasal drip sensation. It doesn't cause actual postnasal drip, but it causes you to feel like you're having postnasal drip. And so we treat a lot of that as well. So if you're just having something that's not responding to your typical over-the-counter stuff and it's bothering you enough to go see the doc, then by all means come see us. We'll do some exams and testing and find the right way to treat it.
Excellent. Thank you very much, Dr. Jones, for talking with me, and Jeanette as well. And I know that we are going to visit with you guys again here and cover some more of these topics. I'm excited to get into the sleep apnea and the snoring, of course, and allergies. That's going to be a big one too. So thank you guys both so much.
You're very welcome. Thank you.